All right, thank you everyone for joining us. I'd like to introduce Amy Knight, President of Children's Hospital Association. Amy.
Thank you. Hello, everyone, and good afternoon. We really appreciate you joining for us today. I'm Amy Knight. I'm the president of the Children's Hospital Association, and it's my pleasure to serve as a moderator for this roundtable discussion with journalists who have covered the mental health crisis affecting children, adolescents, and their families across the United States. Children's hospitals, alongside many other national and local organizations devoted to improving access to mental health care for children and families, applaud the awareness and the dialogue resulting from the significant media coverage in this past year. In October 2021, 3 national organizations, the Children's Hospital Association, the American Academy of Pediatrics, and the American Academy of Child and Adolescent Psychiatry, declared a national emergency in children's mental health. But we were not the first organizations to characterize the escalating crisis and the emergency that we were all seeing. Back in May of 2021, Children's Hospital Colorado declared a state of emergency in youth mental health, a first in their 117-year history of the hospital. With us today is Jena Hausmann, CEO of Children's Hospital Colorado, to provide some introductory remarks for today's discussion.
Thank you, Amy, and good afternoon. Children's Hospital Colorado declared a state of emergency for youth mental health last year in response to seeing so many children and families at a breaking point. And we saw that so many organizations across Colorado that care for our children, from local schools to county governments to primary care providers and healthcare facilities, were overwhelmed by the need for mental health services. Since that declaration a year ago, the number of young people coming to our emergency departments in crisis has only increased. In the first quarter of 2022, we saw a 23% increase in our patients visiting our emergency departments for behavioral health concerns compared to the first quarter of 2021. And that is a 103% increase above the first quarter of 2019 before the pandemic began. It is devastating to see suicide becoming a leading cause of death for Colorado's children. The Centers for Disease Control reported in March that 44% of teenagers in the U.S. felt persistently sad or hopeless during the past year. Despite things getting better in terms of COVID-19, kids now have dealt with more than 2 years of chronic stress that has interrupted their development and turned their sense of normal upside down. Today, children are expected to jump back into regular life again, but so many do not have the resources to do that. They are burned out and they feel so behind, they don't know how to catch up. Children's Hospital Colorado and our peers around the country have made shifts to try and meet this growing need, but it's not enough. Ongoing workforce challenges combined with unprecedented demand have meant that we have increasingly turned to state-level advocacy to try to advance solutions to ease the burden on children, families, and our care teams. We've made meaningful progress, but we still have a long way to go. We applaud bipartisan policymakers in Colorado for taking aggressive steps to invest in youth mental health during this session's last legislative cycle. Like many states, Colorado has consistently underfunded youth mental health services, so it will take continued prioritization, time, and consistent investment to make up for years of accumulated gaps in our youth mental health system. We have partnered with schools, community-based partners, and primary care providers for help in combating this crisis and to provide resources for families as they wait for solutions to take effect. Right now, children uniquely need our help. We're gratified to see this increasing attention to this vital issue that is happening locally, nationally, and even internationally. Thank you for the work you do and for your compassion and sensitivity in covering what is, for so many young people, an intensely personal reality of today's world.
want to say thank you to Jena, really, and to the entire team out in Colorado. They have been a leading advocate for youth mental health, not only in the state of Colorado, but with us nationally. They've partnered with their local communities, schools across the state and even out of state to secure mental health resources for the children and the families that they serve. We are delighted that they were able to participate with us in today's event and really applaud their efforts. Now we'll move on to our panel discussion. The news organizations our speakers represent have invested significant resources in covering mental health in America, and specifically children's mental health, which, as you have heard, we feel is incredibly important. We are going to get started today by asking each of our panelists to introduce themselves, provide a brief history of their reporting on mental health issues, and particularly mental health issues for children, and their news organization. We're going to go in a little bit of an order here. So we'll start with Rhitu and then go to Ashley, Jennifer, and Hannah. So we'll turn it to you all.
Hi, I'm Rhitu Chatterjee. Thank you, Amy, for the introduction and for having me on this panel. Honored to be here. So I'm a health correspondent with National Public Radio, and from 2018, I've been covering, primarily focusing on mental health. And, you know, before the pandemic, my interest had always been covering mental health of the more vulnerable, so kids, elderly, women. I've long covered women and children's health. And I would report on kids' mental health primarily as like little studies coming out every year from the CDC on data on various sort of mental health problems in kids and adults. And then in March 2020, I gave birth to my firstborn, and I was gone on maternity leave for the first several months of the pandemic. And when I came back very quickly, as I started returning to my beat of mental health, not only had my beat not felt more important and relevant, but it became very clear that children's mental health was going to be one of the main topics that I was going to be covering, because as I started talking to just healthcare providers, psychologists, psychiatrists, it became very clear, and my colleagues had all, even the education desk, had already been, in the 6 months that I was gone on maternity leave, had already been covering mental health impacts on kids just by following schools and educators and how they were grappling with this issue. And I remember in the fall of 2020, when I started talking to child psychiatrists at various hospitals around the country. This was one of the first big stories I sort of got into. And they were starting to sound the alarm that they had been feeling overwhelmed with the numbers of kids showing up in their ERs in the midst of various mental health crises. And right around the time is when the CDC put out its first data on the rise in the proportional visits on mental health. And I was fortunate that NPR gave me the time needed to sort of pursue these stories. And we'll talk about more about what those stories are later and like kind of the challenges of covering them. But as the pandemic wore on, this has increasingly, as we all know, become what was already a crisis has come to sort of a breaking point. And we've continued, and I personally have been continuing to cover it. And my own personal interest, obviously, as a new mom, as I was hearing from parents and educators, about horrific stories about kids feeling suicidal. I was kind of, in the midst of holding my 8-month-old infant, and I had sort of a whole new perspective as a parent, as a new parent on these stories. So happy to be here and looking forward to the discussion.
Great. Hello, everybody. My name is Ashley Velie, and I'm a producer with 60 Minutes. I've been with CBS News for the past 24 years. And my first foray into covering mental health was through the Iraq and Afghanistan wars. I was based overseas in London for some time and covered those wars on the ground. And when I got back to the States, as we all know, there was an explosion in the epidemic of PTSD and our veterans returning home who were struggling on multiple fronts. So I did a number of stories, both with CBS News and with 60 Minutes, focusing on what our veterans were coming home with, how they were struggling, and we specifically focused on different treatments they were receiving and how for so many years they were being ignored when finally people started paying attention and giving them the help they needed. From there, the next piece I did that I focused quite heavily on regarding mental health was focused on the impact of war on children psychologically. And specifically, we focused on the conflict in Israel with the children in Gaza and in Israel, and how you have a whole generation there who's really known nothing but conflict, and how they essentially, grow up under bombs and under being attacked, and have very little means to process it, particularly in places like Gaza. So we spent a lot of time there. And I did a piece for 60 Minutes focusing on kind of like the mental health of these children and how people were trying to come into these areas and help them cope and help them move on from living under conflict. And then my most recent work is focusing on the impact of the pandemic on kids. And I too am a mother, and my daughter is a bit older. She's now in her first year of college, but she was still in high school, and when the pandemic hit, and she did fine, touch wood, but many of her friends had issues, and I started hearing from more and more parents and more friends, colleagues. Seems like everybody I spoke to from 6 months onward into the pandemic, everybody knew someone or had a child that was struggling with a mental health issue. So we talked about it a lot at 60 Minutes, and our executive producer, Bill Owens, really had the same exact story. He has children, was hearing a lot of the same from his friends, and he said, we have to do something, and we have to do something now, and this is something that is not being covered. So my colleague, Jena Marz, who's on the call with us as well, set out to really look into how best to tell that story, finding a location. We focused in on Milwaukee, Wisconsin, because of their startling statistics, but also because of their initiative in facing down the problem and seeing that they had very high numbers across the board in regards to mental health in their children, but that they were also fighting to come up with solutions. So with our story, we really wanted to give both sides of it in the hopes of shining a light on the problem, which is a very national problem, as we all know, but by also offering up a set of solutions, albeit at a very local level, but that were having some impact and kind of indicating a way that they were facing down the problem and trying to help a community that is, in such trouble. So that's it. It is something that I too feel very passionate about. I feel that it is not being covered enough. It is not only a crisis now, but a generational situation where everyone we talk to says, if we don't look at this now and really tackle it appropriately and put the resources where they need to be, we're all going to pay for it down the road, and our kids, are going to be in trouble for years to come. So thank you for having me. I look forward to taking your questions, and again, thank you.
Hi, everyone. My name is Jennifer Marz. And as Ashley mentioned, we work together at 60 Minutes. I've been with CBS for 11 years or so, and have covered a wide range of stories during my time at 60. And the piece that aired this past May that Ashley and I did together was really my first deep dive into mental health coverage for kids in our country. And like others have mentioned, I'd been hearing about the mental health issues since before the pandemic and more in relation to adults, but over the past couple years, the kids crisis has really emerged, and I have a young son who was born in July 2020. So he has not been in school and through this, but a lot of my friends have been struggling with getting help for their kids. And as others have mentioned, it's just everyone you talk to has a story and can relate. And it's just become such a huge issue. We felt at 60 that it was really important to cover. And it's a huge thing to try to get your arms around. So it was hard to figure out the best way into it that would give it a face and be able for people to understand it's not just all these statistics, but it's these kids. So anyways, it felt like a very important time to address this issue. And I think the others here all agree that it's an ongoing crisis that needs to be covered. So I'm happy to be here and looking forward to our discussion. Thanks.
Hi, my name's Jena Farfuro, and I'm a mental health reporter at the Seattle Times. I've been writing about children since the start of my career in 2011. I've worked as an education reporter and as a science and health journalist since that time. And I've started focusing more intently on children's mental health around 2017 when I worked at a science magazine called Spectrum. There I was mostly writing about children with autism and other neurodevelopmental conditions, but I also wrote quite a bit about overlapping mental health concerns that youth in particular with autism are diagnosed with. So when I joined the Seattle Times, it was a little bit of a pivot for me. I went back to the education beat. Start over and introduce myself. My name's Jena Farfuro. I'm a mental health reporter at the Seattle Times. I've been writing about children since about 2011. I started as an education reporter, and I've since spent most of the rest of my career writing about children's health. And I joined the Seattle Times in 2019, shortly before the pandemic, actually as an education reporter. And so I spent a lot of time writing about how children were reacting after school closures. I think a lot of the other panelists have already talked about some of the things that they witnessed, but here in Washington, we certainly were seeing, the effects of isolation. Some of the early signs and symptoms that we were hearing about from parents were things like depression and loneliness. And then we started to see the increasing numbers of ER visits. Here in Washington, we've unfortunately seen a rise in suicide attempts, including among really young children, which has been a particular concern recently. So, on the education beat, I was talking with a lot of families and teenagers, but I also started receiving phone calls from pediatricians, hospital workers, psychiatrists who, really wanted the Seattle Times to spend more resources and more time devoted to pediatric mental health. At that time, we didn't have a dedicated mental health reporter, but I was very grateful that midway through 2021, the Seattle Times actually decided to invest significant resources in the creation of a team of 4 journalists dedicated specifically to mental health. And so I then switched over to that team and have been writing about mental health exclusively since that time. Like some of the other journalists on this call, I started hearing a lot about children who were spending days or weeks in emergency departments waiting for inpatient psychiatric care. Families who were looking for a therapist. The wait lists were, again, months or weeks long. So a lot of the things that we saw nationally, certainly we were seeing here in the state of Washington, which historically has had a really sort of abysmal track record of getting both youth and adults access to adequate mental health care. So this is something I've been doing for a long time and feel very invested in. And I'm also really thankful to have the opportunity to talk at forums like this. So thank you again for the invitation.
Right. Thank you all. Thank you to each of you for sharing your story. I'm going to tee up a few questions for each of the panelists, but we also want to save some time for questions from the audience at the end. So we'd ask that you go ahead and submit those via the chat feature, and make sure you include your name, your organization, and the contact information, so that if we don't get to your question today, we can make sure that we get it answered and can follow up after today's briefing. Two important things I wanted to highlight, I think, that were said in our introductions is one, really what is kind of an artificial difference between children's mental health and adult mental health. We've disproportionately not spent enough time on children's mental health, but the irony of it is that adult mental health begins in childhood. And so more than 50% of diagnoses happen or showing signs before the ages of 14. And so what is a child mental health problem becomes an adult mental health problem. So by talking about what we're talking about today and intervening early, we have a lot of opportunity to make progress. Hannah, I'm going to start with you. And you mentioned it kind of briefly there at the end, but if you could talk to us a little bit about the Mental Health Project that the Seattle Times has put in place. So 4 reporters dedicated to this is really amazing for a news organization. So interested in how that came about, and how common is it for a news organization to have such a dedicated team?
Sure. So yeah, the Mental Health Project at the Seattle Times is a team of 4 journalists. We focus specifically on mental and behavioral health in Washington State. Diana Samuels is our editor, and I work alongside 2 reporters, Esme Jimenez and Michelle Bruckman. To our knowledge, this is the first of its kind. Certainly there are mental health reporters at regional newspapers across the country, but I think this is sort of the largest effort to date, although we have heard about other newspapers that are interested in launching similar teams or initiatives. Through our work, we're educating our readers about mental health conditions. We're spotlighting promising treatments that are emerging out of local research. We're lucky here to have a number of research hubs, including the University of Washington. We're also writing watchdog and enterprise stories that examine actions by government agencies, healthcare providers, and other stakeholders. So we're really taking sort of a broad approach, certainly covering the mental health system in the state of Washington, but also writing stories that we feel are relevant to our greater region of states and even nationally.
Thank you. And Rhitu, if we can go to you next. Loved your introduction and the motherhood connection. And, I think clearly it's this mental health crisis has become, we used to say barely anyone knows anyone that doesn't have cancer. And today we're talking, it's hard to know someone that doesn't have a child with a mental health condition today. You spent a lot of time documenting pediatric mental health from a variety of different angles, and you referenced a little bit the challenges in your introduction as well. But just curious, as you're developing a story on children's mental health, what sets it apart from other healthcare topics as you start to think about it and form it?
So several things. One of the things that's most challenging is, I think, a challenge with the mental health beat, but I think is further magnified because we're talking about pediatric mental health. Finding individuals to be willing to share their stories about some of the most vulnerable and difficult times in their lives is, I think, one of the big challenges of covering any mental health story. But when you're talking about pediatric mental health, there are additional challenges because they're kids, and there's issues of consent. How do you, parents giving consent, and finding even having, we'll have providers who are willing to talk about the challenges that they're seeing among their patients, or educators about what they're seeing in their students. But obviously they're all very understandably protective about the privacy of these minors. The other thing is, again, with kids, even if you find a parent willing to talk, it's just really hard for somebody in the throes of struggles to be able to articulate, right, what they're going through, what they're dealing with. And that's even more for kids because they're still developing a vocabulary and trying to understand what it is that they're experiencing. So that, I think, is one of the biggest challenges. The stigma around mental illness and also just the sheer kind of like challenge of living with it, trying to find care. And then, like I wouldn't want to talk to a reporter if I'm going through in the midst of that, and that's completely understandable. So I would say those are some of the challenges. And in the initial days of the pandemic, and even until last year, I think data was also hard to find. Like I remember when I first started hearing reports of in like early fall 2020, right after I came back from maternity leave, talking to pediatric mental health care providers and them telling me what they were seeing in their ERs. But they were like, oh, we're trying to get a national picture. We don't have the data yet. And they were telling me all these things that they were seeing: eating disorders, suicide, aggressive behavior. And especially with suicide, one of the first, and I think one of the most powerful pieces that I've done during the pandemic on pediatric mental health was just the number of suicidal kids showing up in the ERs. And I'm acutely conscious and aware of the pitfalls of just kind of saying there's like, okay, there's a spike in suicide rate, knowing that there is also, an impact on kids who are listening, or people who are suicidal who are listening, and the potential for the impact, what's it called? The Werther effect, where reports of suicide actually cause more suicides. And so that was another thing that's challenging for the beat of mental health, but especially more challenging for if I want to be really careful and make sure I have some data before I say that, there's a potential rise in suicidal behaviors, because teens, young people hearing my story, I want them to come away empowered to seek help and not necessarily sort of fall further into despair. So that's another aspect that I find really challenging. And thankfully with NPR, my editors and the organization has gotten it that it's better to get the story right and tell it with the right nuance and sensitivity and backed by data wherever we can, rather than get the story out sooner. And the other thing is when we're talking to parents, I remember my son was 7-8 months old, and I was talking to the parents of a young man who had died 4 months ago by suicide. And I was doing that on Zoom. And it's still heartbreaking. And I don't know where they found the strength to muster to be able to talk to a reporter. But I think somewhere within they understood that they needed to help remove the stigma as well for other kids like their kids to be able to seek help, for other parents to know what to do. So another challenge with these stories is not just talk about the problem, but also arm people with solutions. So for that initial piece, I also did like solutions-oriented sort of tip sheet sort of piece on what parents and adults in the lives of children who may be struggling with mental illness, with suicidal thoughts, what they can do to help these kids, to again make sure that even though I know that access is hard, just to get across some information to empower the audience to be able to address it and not just feel overwhelmed and just sort of helpless and hopeless.
Great, thank you. I guess a question for Ashley and Jennifer. And Jennifer, you mentioned at the beginning that you started paying attention to this before the pandemic even happened. So clearly this was an issue. And Ashley, you talked a lot about some of the stories you've done on a lot of what trauma has done, whether it be on adults through war or children through war, or now this as well. So, 60 Minutes, obviously all of us know, is a long storytelling kind of format. How did you all decide? You mentioned a little bit on choosing Wisconsin and really Austin and his family and the efforts of the Children's Hospital there to treat mental health patients. How did that come about, if you will?
Well, when we set out to do the story, like I mentioned earlier, we didn't want to just focus on the problem, but we wanted to try and find a place where they were trying to implement some kind of new solutions. And we looked at, I don't know how many different cities and towns, and we're sort of trying to find a place that would strike the balance on both ends. So we were really fortunate. Milwaukee grabbed our attention up front as we were doing our research, because there was this little tiny press release that came out from the hospital, from Children's Hospital, in which they mentioned that they were setting out to launch a brand new walk-in urgent care clinic for mental health just for kids. And we were like, what? Like, we had never heard of that. And it was something that really drew our attention. And it also underscored the fact that, my God, like the city, the country has reached this point where they're opening urgent care for kids only for mental health. So we were fascinated by that, and we reached out to them, and they gave us the whole backstory. They hadn't opened yet. They were just in the process of staffing at the time we called them, and they were set to open in March. And it was through that window, through them, that we began to discover like a citywide effort that was going on, which included, we got this chance to speak to one of their brilliant ER doctors at Children's Hospital, Dr. Michelle Pickett, who has, been in the ER for 9 years and was seeing, like, over 2 years ago, this immense rise, as a lot of the panelists have mentioned, in the numbers of kids walking through the doors with mental health issues, to the point where they see, to this day, at least one suicide attempt a shift. So, again, we're sitting here hearing this information. She's telling us, I've had kids as young as 5 walk through these doors who don't quite know how to articulate suicide, but are saying, I don't want to be here anymore. I want to go up to heaven with grandma. And just these really heartbreaking tales, as was mentioned earlier, kids showing up and literally having to wait or live in the ER or somewhere like within the hospital for 2 weeks with mental health issues, who could get no help because of the lack of psychiatric beds or outpatient care, who had to literally live in the ER for 2 weeks. So, again, though, Dr. Pickett, the ER doctor, presented these incredible solutions. She just said, we now screen every kid that walks into the ER for mental health from 10 and up. And they've had cases where a kid shows up with a broken ankle, they all take the test, they all take the screen, which is on like an iPad, who screened immediately for suicide, like suicidal ideation. So they got that kid off into help immediately, even though the kid showed up just with a broken ankle. Then we discovered a network of pediatricians there in Milwaukee who had launched in the last year or so, incorporating a therapist in their offices as like a permanent fixture. So the long-standing relationships that families had with the pediatrician and the trust that had built, for years since they were babies onto, young kids to teens, they now had a resource right at their doctor's office. If a kid was having an issue, if a mother was like, what, my son seems off, they could walk them down the hall and they could get immediate help with a therapist there, right in the pediatrics office. So all of those sort of drew us in, and just, we thought, wow, this is stuff we hadn't really heard about so much, if at all. And then we were extraordinarily fortunate, and I can't stress this enough, because we've all, as journalists, gone through this, in finding kids who would talk to us. And they didn't only just talk to us, but they, we developed relationships with them over Zoom calls and phone calls, and then meeting them in person over 5 months. So they got to know us pretty well. And as a result, they said that on the day that we showed up with their cameras, they sat down with us and they just told their stories. And it was mind-blowing and heartbreaking, but also encouraging, because when we asked them, why are you doing this? Like, you're putting yourself out there. They said, because the world needs to know. This is one of the things Austin, the 11-year-old boy, said to us. The world needs to know. And kids need to know. They need to know how to get help, and they need to speak up. And they all told us that a number of their friends are suffering and have not been heard, or have not been able to get help, or their parents don't think it's a real issue, or the teachers are ignoring it in the schools. And they're desperate. They're desperate, and they're hurting. And this generation, we found, Jenny and I, in speaking to a lot of kids and a lot of teachers and parents, they're not afraid to talk about it. And they're kind of, I think we've rounded that corner where kids are more willing to express themselves when it comes to their mental health, and be forthcoming. So that's really what attracted us to Wisconsin. And we wanted to, in Milwaukee, we wanted to have sort of this microcosmic example from which we found this balance of the problem and solutions, and to be able to, as Rhitu said before, you can't just offer, you have to offer some hope, or you have to offer some stories or resources or ways for people to move forward. So that's kind of where we landed. And Jenny can add to that as well, because she was, we did this together.
Sort of, just to add just a little bit, Ashley covered a lot of it, but the reason we focused on Wisconsin and children's there was because we'd been looking for months for a way to cover this topic, and we needed, we're TV, we needed something visual, and we needed a lot of different parts, and we wanted something that hadn't been thoroughly reported on already. And so this little press release that we found really caught our attention, because we'd heard of urgent walk-in clinics for adults, but it was the kids only that really caught our eye in the headline. And it was open after school hours. So it was really tailored to this community, to parents who didn't want to take their kid to the ER, but it was, the pediatrician's office was closed, and this clinic was open from 3 to 11. So it gave them an option other than the ER. And it was just a unique, we felt at the time when we found it, a unique and creative solution that hadn't been widely covered yet. So we sort of grabbed that. And then, as Ashley explained, we found a lot of other interesting things they were doing. So.
Can I chime in here a little bit, Amy?
Absolutely.
To reflect on what Ashley and Jennifer was saying. It's the solution. The solution bit. It's not just about also giving them hope, but I've also found that during the pandemic, and several people, educators and healthcare providers, have said this to me, that this time of crisis has also pushed many people to innovate on the ground. Mm-hmm. And I think it's become really important to highlight they may not have been scaled up yet. They may be just a nugget of an idea that somebody started to implement, but they can also be a great way to tell the story of the problem through the lens of a solution. And there are many such innovations on the ground, and often providers in different parts of the country don't know what others are doing. Mm-hmm. And we did a very similar story last spring or summer, when one of the providers I'd been talking to about the rise in ER visit story among kids for mental health in Northwell Health on Long Island had started working on an urgent care for kids, but working with schools. So schools could identify the kids and send, and all they had was a child psychiatrist, a child psychologist, and a social worker. 3 people who were already working within the system, or maybe they hired somebody new, I can't remember. But this kind of collaboration kind of happened organically, and they had started talking even before the pandemic, but I think the launch of the clinic happened and it really took off, even when it was virtual in the early days of the pandemic. And I think that story, when it aired, within 24 hours, the team had heard from 3 or 4 different states about to get help and starting something similar. So I think it's also our role as journalists, it's as much as highlighting the problem, but also like within like the community of providers, it's important to hold up these sort of innovations on the ground, not just for sort of the larger public to know about, but even providers to sort of connect with each other on solutions.
That's an amazing point. And actually, just as we were listening to each of you, I mean, the solutions piece is huge, and the sensitivity of which all of you all just described, I can say from a children's hospital perspective is highly appreciated. And the ability you have to connect sometimes disparate providers is as you just highlighted, Rhitu, is incredibly important. Wanted to dig in a little bit on some of the things you all just talked about as well. Kind of a piece of that, Rhitu, as you also highlighted earlier in your comments, is around data. Data is not an easy thing to find, and is part of telling that story. It's also part of telling the solution, because we can show improvements in the data, et cetera. As we've described, this is an underreported area. It's something that could draw more attention. So just a little bit of conversation from whoever wants to comment, really, about your experiencing getting the data you needed to tell your stories, what that was like, some of the challenges of it. Obviously, the personal stories are incredibly important, but so is the data piece as well. So I'll just throw it out there and jump in as you will.
Jump in. There are a number of stories that we've focused on at the Seattle Times around emergency departments in particular. And we found some of the first data that we had on emergency department visits actually came from the governor of Washington, who declared a pediatric mental health crisis in March of 2021. And in his declaration, he had collected ER visit data from the children's hospitals across the state. And so I sort of latched on to that right away and wanted to know more, because certainly there was only a little bit of data there, things like how many visits they were seeing per week. So that allowed me to go, right directly to the children's hospitals and ask them for more detailed information. And thankfully, they were very happy to provide that data. So, that told us one thing about what ERs were seeing just in terms of raw numbers on a daily or weekly basis. But soon our stories became about all of those kids who were boarding in the ER. So we've all sort of talked about this phenomena of children waiting weeks. And in the case of Washington, unfortunately, many kids are waiting months in ERs or in acute care units waiting for a psychiatric bed. Getting that data was a lot more difficult, actually, because at least in Washington, there's no hospital code for boarding. That's just not something that the hospitals here code for. And as far as I know, many children's hospitals don't keep that kind of information. Thankfully, a lot of the hospital administrators who I was working with were able to look back in their records and at least sort of pinpoint, this child I know for sure was here for more than 24 hours, which was kind of the cutoff in terms of boarding. So I really think it was the partnerships with hospital administrators who wanted these stories to get out there that allowed us to get a handle on it. Also, the state healthcare authority here had a decent amount of data because, they end up paying hospitals back. And so certainly that's where finances come in. So they were able to provide us with data as well. But it was really pulling from a lot of sources, doing some FOIAing at the state level that allowed us to get the full picture.
Yeah, I can jump in as well. Yeah, this was a big part because, belonging to the science and health desk, when we get pitches, we're like the constant sort of metric is like, can we really say this is the trend? Does the data back it up? And with kids' mental health, with an evolving situation that's changing, and data often lags behind what's happening on the ground. So obviously that's an issue and it was very challenging for us. So I remember what I ended up doing was I just talked to a lot of providers at children's hospitals. Some of them had done a better job of keeping track. So I remember there was, I think it was Indiana, I can't remember, Indiana, and I think there was a hospital in Indianapolis, and I think a children's hospital in the Bay Area had like more concrete numbers, and all the other providers were like, we're gathering data, but we can tell this is the comparison from this year to last year, and this seems to have increased. But so it was not complete. It was, we went with whatever we could find, but obviously that meant that, I think I talked to providers in 7 or 8 states. And then there was obviously the CDC MMWR on ER visits for children with mental health needs, which I think for months and months was sort of the only national picture we had. Maybe until even earlier this year or late last year. And obviously Amy, the Children's Hospital Association, whatever data you guys have put out has been, even though it's not fully nationally representative, it's a window into and kind of mirroring all the other trends people are talking about. But yeah, this is an issue and takes a lot of extra work in making sure we're getting our facts right.
Yeah, we definitely encountered the same issues, in that we were having trouble getting comparative data that would speak to the trend or the overall picture in the country. And the CDC, we were leaning quite heavily on them. When we did decide to focus on Milwaukee, specifically in Wisconsin, the state, because some of their data drew us in initially, it became a little easier because we were then able to go to the specific, to the hospital, to the pediatrician, to the, and get them to crunch numbers, but they didn't exactly have those ready, most of them. Like, we had to ask, and they had to go back and assess, and they had to do like a certain time frame for us, but they weren't just always readily available. So that is something definitely that is lacking, particularly in trying to understand the national picture, and something that I don't know if the children's hospitals could sort of band together and come up with a system in which there's like a national input or something whereby you're keeping track of the numbers as they're happening, because the month to month at this point, particularly as we're kind of like still in and emerging out of the pandemic, is what a lot of people are most interested in, to see where those trends, because we're by no means, as one therapist told us, we're not at the end of this. And it's just gonna continue on, even if the pandemic improves. So yeah, that was definitely an issue that we struggled with, and is definitely something that could be improved upon, so that journalists have an easier time and don't have to dedicate as much resources and time and hair pulling to figuring it out and making sure, as was mentioned, that we have it absolutely right. So yeah.
Okay. Thank you. We did have a question come in the chat from Bethany, and that is, how did you overcome privacy issues when speaking to patients for broadcast? And was General Hospital and parental consent used, or were there additional guidelines put in place to protect the patient and the family's identity?
Well, when it came to, everybody was extraordinarily vigilant with consent forms and with HIPAA, obviously. And, that's always like a tricky, sticky situation where you get some broadcasters who come in and abuse that, and it's not good for anyone. So we had to really, even though we're 60 Minutes, we had to keep reiterating that, look, this is not our first rodeo. We've dealt with many hospitals. We've dealt with many scenarios like this. It's okay. I'm in control ultimately of what's seen in the editorial and the actual piece that goes out. So you're good. But it's this kind of, it's always this difficult dance where, you just have to ultimately trust each other, and then absolutely, have consent forms signed and have it made very clear to everyone who's involved what they're getting involved with. And like I mentioned, we spent 5 months on Zoom calls and phones with particularly the families and the kids, so that they knew exactly where we were coming from. They knew what was going to be asked of them, and they knew they could trust us, you know, because we developed a rapport. Not everybody has that sort of luxury of time to develop those relationships. So it's just kind of, you know, you have to be extraordinarily careful to protect all those involved, particularly minors, to protect us, because, you know, we are very responsible and liable for everything we put out there. It's just, at the same time though, it's really important, and we ran into this a little bit, that the hospitals and the people trying to get the story out, the medical providers, have to step back sometimes and see the big picture. You know, there tends to be tunnel vision, like, oh, you can't do this, you can't do that, and like, and everybody gets very nervous. And I totally get that, and we understand where everybody's coming from, and we know it can go horribly wrong, but it can also jeopardize the story and the message of what they're trying to get out there. So there has to be some kind of stepping back, so that the information is truly allowed to get out there in a way that is going to resonate through people that can best tell those stories. And I think a little more sort of like collaboration and compromise, once that trust is built, is a great thing, and it goes a very long way in terms of the impact of a story.
And just to add a little, when we were filming at Children's Wisconsin, and we were, you know, in the ER with the cameraman, and it looks like, you know, it's overwhelming to, and the doctors are all trying to do their jobs, and it's the ER, and people are, you know, coming for serious reasons. So we stay off behind to the side, and we waited for the press people that we were working with there to, of course, clear anything with all the patients before we whipped out a camera and filmed anything. It was very much understood, like Ashley was saying, what was going to be done, and we weren't just, you know, taking a camera to film any and everything. So, but it looks like more than it is at first, so I can understand the hesitation. But as Ashley said, it's really helpful and important to get the hospital's story out, that they, you know, we compromise and talk through.
One thing that I will also add about the privacy issues is in my stories, whether for adults or kids, but especially for kids, I do end up, you know, going with requests for not using their full names. People will often ask us to keep them anonymous, and I have to explain to them, we don't do that. We don't use a pseudonym. But I often go with just first names, or sometimes their middle names, because the stigma is real. And, you know, the goal is for these stories to help others in these situations, and not in any way to come back and hurt the people who are putting themselves out there. So that's another thing that I'll put out.
All right. Kind of relative to that, and you all talked a little bit earlier, and actually quite a bit about the focus on solutions. I mean, that's an area that clearly all of you have tried to bring to the front. You know, as we kind of look forward, are there other aspects of what I would call this crisis or the story that you hope will get more attention, whether that's around the patients and families, whether that's around the care system? You know, what are some of the things that need further destigmatization, excuse me, or could use some more attention as you look at the issue?
I think access still needs to be the focus, not just on the sort of healthcare system, but also even when families find a provider, just the lack of parity in insurance is such a big issue. And also like the lower rates of reimbursements for providers. And that affecting care, like how many people, not just with kids' mental health, but also adults, like that's just how many people fall through the cracks because insurance companies don't cover mental health the way they cover physical health. That's an issue. I mean, they're harder to tell stories. But I think that's going to be, it's really, and nobody who hasn't attempted, like I am still learning about the system just by covering it. And I think it's really, really important that those stories get covered. The other thing that I think Ashley had mentioned, how the generational shift that's happening with like young people not feeling as stigmatized and kind of talking about their emotions and feelings, and that kind of comes up a lot. And I also know that there are providers who are working with teens and kind of coming up with solutions that work well for them. I think those stories, like I personally haven't explored, and I know it's happening out there, but I think we need to start to focus on those kinds of solutions as well, with young people also being part of the solution in multiple ways.
I think, a lot of the stories that I've certainly been working on and read myself or watched or listened to have focused on ERs and hospitals, because in many ways, this is the most sort of visible or example of what this crisis looks like. But I think that there's still a lot of work to be done to look at so many other aspects of the mental health system that help explain how we got here and how we got to a place where there are so many youth who are living in ERs or coming in, with suicidal thoughts or attempts. Here in Washington, certainly the foster care system is been decimated in many ways. Access to special education went away, it disappeared for many months or even years, depending on what school you were in. The workforce crisis is huge, whether we're talking about pediatric mental health or adult mental health. And so I think that's an area that's received a decent amount of attention, but when we're thinking about solutions, that's not a quick fix. So I think, thinking creatively about how to bolster that workforce will be a big storyline for reporters like us to think about. And then, for me personally, going back a little bit further in time and looking at the way that at least my state set up the pediatric mental health system, many years ago, and what that's looked like and where the holes have been, because pediatric mental health has been chronically underfunded. And so I think there's a lot of accountability storytelling that we need to do to look at these funding streams and some of the chronic problems, honestly, with where the money is going and how it's being used, or, whether we need more of it. So there's a lot of, I think, watchdog journalism that's probably a good next step.
Yeah, I would echo too. I mean, I think the thing that just astounded us throughout all of our reporting is the lack of resources, and whether it's like the burnout rate of, therapists and psychiatrists, the pandemic, people within the profession having to deal with their own issues, having to leave the profession, and as a result, there are fewer places to find help. Just the schools not having the proper sort of infrastructure when it comes to, as Rhitu mentioned, there was like 2 or 3 people within the school dealing with sometimes thousands of kids, who need attention, and just kind of the fact it's really alarming, as we did in our reporting, and as others have said, like kids are having to wait months to see a therapist and a year to see a psychiatrist, a year. I can't even imagine being a parent, being in the middle of a crisis, picking up the phone and everybody saying, "Yep, sorry, booked up, can't get help." And there you are with a child who's in danger. And it was just stunning how this was we discovered this is what the country is living with, and what parents are having to grapple with in every single community, rich, poor, rural, urban. Everybody is facing the same kind of challenges. And I think the other thing too that really interested us is just the idea, and it was mentioned by our pediatrician, Dr. Nimmer, the idea of being proactive, right? So you're not reacting to the child in crisis when they hit a tipping point, but you're with the kid from a young age, and there's a communication going on, and there's an understanding of the child, and there's an understanding of everything that's going on in their life. And having that level of communication, like she basically said, we now have to serve as equally as much as a mental health, like a therapist or a psychiatrist. We have to serve that role too. And she was having to do a lot of quick studies to get up to the level during the pandemic where she could handle the onslaught of mental health cases she was seeing at the pediatric level. So I think the proactive side of things is really important, as it is with everything in life, but with this in particular, because I think if you can get at it earlier, you're gonna prevent so much down the line with these kids as they get older, and it's going to be just far better for everybody.
Another question come in through the chat from Marjorie McKee with Medical Decision Logic, and she was curious about covering technology use as a solution for mental health. Have any of you all explored that or seen that in terms of telehealth or other things relative to the work that you're currently doing?
Yeah. Oh, sorry. Go ahead.
No, go ahead, Ashley.
Oh, no. We discovered it because of all the people we spoke to, the therapists and such, talked about the need for having to suddenly switch gears in the middle of the pandemic and go into virtual therapies in order to continue to talk to their patients or to take on new patients. But I have to say, the kids we spoke to who used like telehealth psychiatry or therapy appointments, and even the doctors and the therapists said that it's not as effective, but they were having a really hard time. The kids were losing attention, especially the younger kids, and they regressed even, and they just decided they didn't want to do therapy anymore if it was remote, if it was through telehealth. And while people looked at it as like, okay, it's it's something, I don't know if it's been perfected enough. And they all talked of that in-person, that need to be in person. And, we even heard a horrible story about one of our therapists who was checking in periodically with a teen who was struggling. And it was again, only over a phone or over, Zooms. And the girl had a really hard time losing that contact and having those conversations and face-to-face with the therapist. And it didn't, she ended up in the ER, and this therapist felt tremendous guilt because she said, if I had been there with her in person, if things would have been different, she wouldn't have ended up in the ER, that she felt there was a wall, there was a separation. So while I think it can be a good solution, and it's something that everyone's trying to work into their vocabulary, I don't know for kids if it's necessarily the best option.
So I've heard both. So I've heard providers say that for some kids, especially older teens, it's worked really well. And even sometimes for it doesn't work for certain groups of kids who are sort of more at the crisis level or closer to a crisis, that in-person contact matters a lot. For super young kids, they can't stay focused on the screen if they're around their toys or whatever. However, for certain groups of kids, child psychiatrists tell me that it works really well, because now they have a deeper insight into what's going on in the life of the child. What's their home situation like? So they have more window, and sometimes they can even connect with older teens, around stuff that they're doing. So seeing what's in their room, seeing what else is they're doing, and teens often prefer that. And one of the things I was on a panel with a psychiatrist who who has a startup at Stanford, and she was saying technology is going to be really important, especially for teens, because they often need the help, especially when they're in crisis. Not for everybody, but for a lot of them, they need like to be able to connect to a group like right now. And that time, it's often like late at night when they're in crisis. And that's not when they're going to be able to get an appointment, or they have to wait to get an appointment. So it's also like not either or, it's going to be finding who it works best for, who, under what situations and circumstances, at what level of kind of need and urgency in kind of the spectrum of their symptoms. And regarding the general question about whether we consider technology as a solution story, we do, but we also get a lot of pitches about like various apps and various efforts, and it's hard to do a story on all of them. And a lot of those pitches don't have the results yet. Like, oh, we just launched an app and this is what it's meant to do. They're doing this screening. So it's often with these solution stories, we want, whether it's a technology solution or otherwise, having a little bit of data on the impact actually helps make it a story.
Great, thank you. One other question. You all have, obviously some of you for many years and some for fewer years have kind of been tracking this discussion on youth mental health. A question and kind of relating it to things as we think about how it's shifted, whether it's since 2020 or whether it's maybe since 2015 or, even going back to say 2000, if we relate it to some other public health crises, and we'll call it a crisis here because that's what we believe it is, whether it's smoking or the AIDS, and in each one of those, the Surgeon General has kind of come out, and the Surgeon General has declared this an emergency. Do you think that'll change a shift, or are you seeing a shift in the conversation? Both. Just kind of curious as to your perspective on that.
Definitely. I mean, when I started talking to say, I'm thinking of pre-pandemic and even post-pandemic in 2020. Fall of 2020 to fall of 2021, there was a dramatic shift where like providers that I'd been talking to for over a year, and they'd been saying, oh, we're just like the stepchildren, even in the mental health field. Kids are just sort of like, nobody thinks about. Even child psychiatrists complaining to me that like their adult psychiatrist colleagues don't consider their work, regard their work very highly. Going from that to where pretty much everybody, even say it from my, like in the newsroom, recognizing and understanding and experiencing some level, knowing somebody who's experiencing or watching, witnessing a child struggling or a teen struggling. And yes, the Surgeon General's advisory last fall was big. And just the time that mental health and youth mental health specifically got at the State of the Union address this year, like all of those are, I think, significant. But and also I have seen just not about youth mental health, but it's also a time, even during the Trump era, there's been growing bipartisan interest in addressing mental health overall. And in the last year, obviously, in all the hearings, there's again bipartisan interest in addressing youth mental health as well. So I hope that bodes well, but eager to hear what others think.
I think in what we found is in talking to kids and teens, I think this was touched on, but they're much more open to speaking about it. And the two teen girls we talked to in our story were surprising to me. It was very surprising how open, and they have conversations, they said, with each other and with their friends. And one of the girls, or both of them, have been through a lot personally, and they want to be the friend that their friends come to for advice, and they're not, hiding it. And they've missed weeks or months of school, so it's known that they've been in treatment or are struggling, and they still want to be a person who can support other friends and in my experience in school, in high school, none of us among our friend groups talked openly about this stuff. So I thought it was really interesting how open they are, the kids.
I think too, the nature of the pandemic and the sort of collective trauma that we've all experienced and that kids in particular have experienced have just, I don't know, laid the groundwork for people to talk about the mental health care system and lack of access as a systemic problem, which I think is a newer conversation. Before the pandemic, I remember pitching a story actually about youth mental health in schools here in Washington. A number of schools and high schools in particular have healthcare centers on school grounds. And I was interested in focusing on some schools that had either a social worker or a therapist as part of those health centers. And that felt kind of like a novel idea, but to pitch that story now, I was kind of like, oh, of course they would have, or they would want to have those sort of professional staff on campus because so many youth need that support. And so I feel like, even just a couple years ago, maybe we felt like these were individual stories, and now it just feels like a collective story.
What we found interesting too is that, and we were very careful to report that this is not something that the pandemic suddenly triggered. I mean, as we all well know, the declining children's mental health has been going on for some time now and was coming to a head before the pandemic, and the pandemic just kind of exacerbated, or in some cases triggered it. But a lot of folks we talked to said that in some ways it's been odd, because as horrific as the pandemic has been, it has turned a light on children's mental health, and has given people are looking at it differently because of the conditions that young people find themselves in, and because the rates have gone up so much. But they feel that there is more attention now, that they're trying to seize this opportunity to move forward with it, and to get federal funding, to get federal attention, to get backing, to get more support in schools, to get greater, mental health resources within the communities, so that, in some strange way, they felt the pandemic put a light on it, so that, they welcomed that.
Absolutely. We have one more question. How do you think that the social media has impacted the conversation around mental health, especially in being able to connect with others going through similar issues? And, so there's a positive and a negative, and you can probably comment a little bit on both there.
Well, going back to our story, a recurring theme that we heard from everybody, particularly the teen girls, is that social media is part of the problem, particularly in their worlds, and how they believe it's pushed a lot of young people, for various reasons, whatever those reasons may be for the individual, to anxiety, higher levels of anxiety, or to eating disorders, or to depression, or to, God forbid, suicidal ideation. So we weren't hearing the most wonderful things about social media in our coverage, from doctors, therapists, kids, parents, teens. It was something that definitely everybody focused on in kind of in a negative light, in our experience from our story.
I'll just add that the Wall Street Journal in particular has done a lot of reporting on TikTok and the way these algorithms are set up that reinforce some of the conditions that Ashley just mentioned, eating disorders in particular. So there's a lot of reporting out there that I would encourage you to look at, that look at sort of the way that these things are actually baked into social media to cause harm, whether it's intentional or certainly not. I imagine it's not, but there's a lot of, I think, good reporting out there that brings to light some of the serious damage that's been done by some of these platforms.
I'm going to ask you all one more question and then we'll start to wrap up. But I mean, really appreciate the time and that you all have spent not only today with us, but the focus and the attention that you've laid on it, giving these kids dignity, giving our collective children. And we know the children are all different, right? So we are talking about children in general today, but we have different cultural expectations, different racial situations. And, we have LGBTQ, so we're addressing all of those in many ways. I guess our ask for you would be just to give us some homework as you look out today and think about that. What is something that the viewers can do in their work to help journalists like you continue to cover children's mental health? Each go.
Right, I'll go first. So I think going back to what Ashley was saying earlier about providers needing to think out of the box when talking to journalists in terms of giving access. I think healthcare providers, as they try and connect with media more and try to get the story out, I think they need media training as well. Yeah. And kind of a sense of how journalists work and what they need. And I think they need more guidance up front, just even much before they're actually maybe contacted by a reporter. So that, I would say, is one. And always, as long as you can find, kids, it's hard for kids and families in the throes of a crisis to talk, right? I think everybody on the panel here would agree on that. But identifying kids, families who are open to talking about it when they're able to, and sort of keeping in touch with kind of having sort of a spreadsheet of contacts and names, and kind of have that be a part of the media training and kind of whatever an organization does. I think that's very helpful. And also identifying reporters who are doing a good job and building relationships with them, not just around individual press releases and events.
Yeah, I agree 100%. It's really about the accessibility factor. It's about, doing a better job of understanding what we're trying to do. Sometimes, this may be too harsh, but sometimes we're looked at as the enemy, but we're looked at as the people who are trying to intrude and trying to, when we're really there just to, particularly with these stories, we're really there just to get that message out and to get eyes on it and to have, Americans understand what's going on, to wake up and to start to try and fix some of these things. So the more that, everyone can sort of build in that trust and, like Rhitu said, just develop the relationships with the journalists, and open things up a bit more, and think creatively about it. One-page press release is good. It's ultimately what drew us to Wisconsin, but there needs to be more. There needs to be more of that and done in sort of creative ways, particularly highlighting what your particular hospital, healthcare network, whatever it is, it's doing in innovation, or what they're seeing, or in a way that's going to attract journalists and get us in there to tell the stories.
And when we come with requests, it's often a lot that we're asking in the moment, because we're trying to figure things out and if this is going to work and set it all up. And a lot of times the first answer is no. So helping us think of creative solutions to do the story, if it's an important story, is really helpful.
I think, if you work in a hospital and you've decided that there's an important story to tell, being the person who's willing to have that really courageous conversation with a reporter who is going to tell the story truthfully and fully, I think, some of the stories that I haven't been able to report out just because it's been either tough to get data or tough to get people to talk on the record are stories about disparities in access to mental health care. There are a lot of stories out there about youth of color that I really want to tell, and it can be hard to get hospital workers or administrators to open up and share that data. If you know that's a story, being willing to be that person. I know it can feel like a lot to put yourself on the line, but I think, the more that people can rally together and feel that these stories are important, the easier it is for reporters like us to tell those stories. So I think all of us kind of acknowledge this can feel like a lot to ask, but in many ways, I feel like we all have the same goal. So acknowledging that and finding that trust, I think is really important.
Thank you. Thank you to each of you. And unfortunately, I think we're running out of time, though I wish we were all in the same room and could keep talking for a few more hours, even after the public part is over. And just wanted to thank you again for your sensitivity to the issue and the humanity that you're bringing to these stories. And then also just you spoke to the professional challenges that this brings, but also the personal. It's putting yourself out there a little bit and feeling things that are very difficult. So the work you all are doing is amazing. And the conversation today has been so very thoughtful. So just thank you kind of for your passion and your advocacy for kids and for their families as they go through this difficult time. Ashley, I think, as you said, we're in some ways we're at the beginning of this crisis. It's probably been going on for many years to come. Children that were 5 during the pandemic may show signs at 9 or 10, 11, 12. So I think this is a reality we're going to be dealing with for some time. So without the work that you all do, we wouldn't be able to have these conversations, and also to the providers and the families out there who have so willingly shared. We're incredibly grateful. We also wanted to thank our audience for engaging with us today and with this, and to Forbes Tate for hosting this event. So we appreciate all your contributions and hope to continue these conversations on the record in some cases. So we appreciate it very much. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.